Welcome back, everyone. This is part 2 of Dr. Nel's journey from nursing, student visa to nursing to being a trainee GP. So we're just waiting for Dr. Nel. Hello, welcome back. I don't have a free, I only have free Zoom, so I did not invest on a paid Zoom. So let's continue our your inspiring journey. So
Thank you.
82, you passed it. Congratulations. And then what happened next?
Yeah, when I so what happened was after I passed my clinical exam, I was employed as a junior house officer. So on that particular department, I was a clinical nurse. So when I passed the exam, they changed my employment contract to a junior house officer. So I still work in the same department, the same unit, but now with a doctor in me.
How cool
So
is that?
yeah.
You
So
must be very proud.
yeah, I was a bit thing, but there is also some raising of the eyebrows of the other people because you are a nurse. I'm not gonna listen to you. I encountered several encounters in that. So to cite an example, I was working with a GP who don't have any ED experience, but because he left the GP world, he went and worked in an ED. So he was my considered consultant. But to compare, I am more experienced in ED than him. So one of the nurse butt in and went to him, even though I was seeing this patient. I said, like, why do you have to talk to Dr. X when I was the one managing the patient? And she said, she's the most senior, he's the most senior here now. You're just a junior. I was like, but I'm still your senior. I'm a clinical nurse. You're a registered nurse. So I would just I'm still have, because at the moment I have 2 registrations. I am a registered medical practitioner and I'm also a registered nurse in Australia. So
OMG.
I'm still having I could still do both. So and then I know the department very well, having worked there for 5 years. So and yeah, so that's happened, but I just took it as if like, oh, that's okay, I'll just let it go. So but those are some of the circumstances that you will have to encounter, that there are really people you will met along the way in your practice when you come here, that will raise eyebrows on that one. So went to the junior house officer as a limited registration. I sat my clinical exam, passed my clinical exam, but because the requirement with the Medical Board of Australia is anyone on a limited registration who passed the clinical exam, you will not earn your general registration if you haven't rotated into the compulsory rotation. 8 weeks in emergency, 10 weeks in general surgery, and 10 weeks in medicine. But the hospital I'm working at the moment, during that time, only have emergency. So I couldn't registered as a general registrant because I haven't rotated in surgery and medicine. So because I've got connection to the public, because I work as a clinical nurse at the public, I went there, said, look, I need this rotation, which they happily accommodated me. So that's the asset of knowing people and showing your potential and capabilities to them. Then you could easily get hired if you will ask something. So no question asked. They suspended my contract with the private. I moved to the public, rotated in general surgery and medicine, just to tick off my requirement for APRA. Once I've finished my rotation, so I started as a junior house officer for 6 months with ED. I moved to the public as a senior house officer, 10 weeks in medicine and 10 weeks in general surgery. Then, after completing that requirement, while waiting for my general registration with APRA, I went back to ED as a registrar. So that's my way. So just for the information of everyone. That's the level of progress we have in Australia. So from year 6 medical student, you graduated. They don't have any registration examination here, just like us, that we need to take this board exam 4 days consecutive weekends. What they do here is year 6 student intern for a year and then become a JHO, so junior house officer for a year, and then senior house officer. Then depends on you which field of medicine you want to become a registrar to. So you will apply to different, for example, pediatric. Then if you are interested in pediatric, then you can become a pediatric registrar. So pediatric registrar is more or less the same as a resident, a senior resident in in the Philippines. But so you're gonna become a pediatric resident registrar or an emergency department registrar. So basically, a registrar is already a sort of a junior consultant in a way, but not fully accredited one, under a training. If you are not under a training, we call it principal house officer. So if you are a principal house officer, you are already a senior level on the resident level. However, you are not under a training. You are not under a training pathway. If you are a registrar, then you are now already on a training. So at the moment, I am on a training. So I am considered as a GP registrar slash ACRRM Fellow Trainee, because once I finish with this one, I will pass the exam, hopefully. I will be considered now a fellow with the rural and remote medicine. So that's what I'm looking into at the moment. So
May
that's
exam pa
my,
yan? May exam
yeah,
pa
we
yan?
do still have exam there, Doc.
The bloods after 5 days. It is not APO incapability because APO.
Okay. So may exam pa yan?
So every college has an exam. So if I have a bit of idea for the rest. So because I work in cardiac catheterization cath lab, interventional cardiologist, the consultants I've worked with are always like, they're very, very supportive. They're asking me, when do you want to join our training here, blah, blah, blah. But the
Wow.
thing, guys, is 10 years. I'm already nearly 40. I'm 40 now at the moment, in few months' time. If I'll finish 10 years, by the time I'll finish interventional cardiology, I will be on the retirement age. So no
Of
more
course
time
not.
for
What are you talking about? I'm 50.
I mean, because that's the basic, doc. That's the basic cardiology, though. That's not, you need to subspecialize and everything. So nearly 60. So I will become by that time. So I choose I didn't choose the RECGP, which is the Rural Australian
Oo nga,
College of
bakit nga?
Gynaecology Practitioner, because RECGP, the difference between the ACRRM and the GP, RECGP, is the ACRRM, the Australian Rural and Remote and Medicine, is you can work as a GP and you can work as a hospital doctor at the same time. The GP,
Oh, yes, yes, yes.
RECGP, the RECGP is you will be on the GP, you'll be on your clinic, those sort of thing. And you can be specializing in skin cancer, women's health, those sort of things. But
Ah,
for ACRRM, because my passion is in a remote area, I wanted to become a retrieval with the rural flying doctor service, or being a medical director in a smaller hospital.
yes.
So because once you become an ACRRM, you can man a hospital. So similar to our whoever is if you're familiar with the district hospital back in the Philippines, we have that kind of setup in the hospital here, but it's a little bit higher though. But it's in a regional area.
So, ibig
So
sabihin, procedural ka rin. You can still do
procedural,
procedures, you
yes.
can do
Yeah.
theater, you can do surgery, you can do...
Yeah.
So, you're
Do
all-rounder,
anesthetics.
you're emergency doctor, you're general medicine, you're a surgeon in the hospital, manning everyone.
Anesthetics, yeah, yeah. You need to
Wow.
be specializing in anesthetics. So that's the reason why I did the ACRRM, because I am a type of person that will get bored sitting on a clinic and talking to people and those sort of thing. I want
Mental
adrenaline.
health.
Yeah, I want adrenaline. So, and also mental health is a big thing here. So guys, if anyone wanting to come in Australia in an easy pathway, do the psychiatry. You will be very, very syllable. Meaning to say you can easily get employed if you are doing
But it's still
psychiatry.
challenging to get into the training. There's a lot of
It
people who want
is,
to do it.
yeah, so that's one thing in there. So that's my pathway at the moment. So if you still want to, but with your case, if ever you just started at the moment, what you will have to do is go to the standard pathway, apply to the hospital as an RMO. So RMO is the resident medical officers. It is stand as a resident medical officer. It has a two umbrella. It is an umbrella of your junior house of it is an umbrella of the junior house officer and the senior house officer. So it has more or less the same task. There's the same job. The only thing is you're differently paid in hourly rate. So that's one thing. What other question was it there, Doc? I've read about bullying and sort of thing and
Well, maraming fear of going back to zero. How do you overcame? How did you overcome your fear or coming to Australia and going back to nursing, doing nursing and, swallowing your pride? How,
I think
what's
it
your
is
why? What's your why? What's your greatest motivation? What helped
first
you
first and foremost,
fight,
if
fight, fight?
when during my first year here, it was really a very struggle thing. You need to go through depression. So I self-diagnosed myself that I have depression, but I think I overcome it as well. So I always think the positive way. Look, you will get, it's a normal response of every human being that you will get sad, that you will get depressed. But the thing is, that's what I'm proud about us Filipinos, and especially you fellow doctors, that you are not easily break. So that's one thing. So you've been through a lot. Medical school in the Philippines is not easy. Their medical school here is nothing. Our medical school
Yung
there.
medical school dito, oh my God, ang dali-dali ng mga ginagawa nila, pati internship, OMG.
Exactly, Doc. That's what thing I've been through. Being in the fourth year medical school in us here, you go to
We go
at
through
7 o'clock
hell.
in the hospital. 7 o'clock in the hospital. I don't know whether it's the same with the rest of the university, but CIM. I don't know whether you are familiar with CIM. That's how we are be trained with the CIM, Cebu Institute of Medicine.
AM.
Yeah, go. So 7 o'clock in the morning, you are still a fourth year, I think fourth year
Clerk.
clerkship. 7 o'clock in the morning, you go to your duty, you go home the next day, 5 o'clock in the afternoon. So we call it the
Sometimes 7 daw.
36 hours duty. Then the next day, you come back again at 7 o'clock. Here, they will come at 7 o'clock in the morning. They go home at 6 o'clock. They're already complaining that they have a very long day and everything. So that's how proud I am with how we are being trained. They might have the facilities, they might have the equipment, they might have all the microscopic thingy to look up to the smallest nanoparticle in medicine and everything. They might be able to have that one. But I would still be able to tell you guys, my fellow doctors, you still have the skills more than them. I'll
Teka
tell you that.
muna, galing ka sa off-duty ka ngayon, and you're on your second year of ACRRM training. How does it look like? What does it look like? Can you just describe to everyone paano ang duty mo, how many hours, and then kunwari, are you on for 5 days, and then are you off for how many days? Ilan days ang day off mo? How's your roster?
So when I joined so at the moment I am rotating because I'm already done with the ED. So when you do with the ACRRM, you need to specialize with advanced skills. So I'm already done with the ED. So you need to have one particular advanced skills with ACRRM. So that you could work in a hospital as well. So when with me, I'm doing my core generalist training, which is a requirement for ACRRM. You need to rotate in a GP practice for at least 6 months. But for me, I said I will not be learning. I'm not going to be learning by 6 months. I want 12 months. So I signed a contract for 12 months. However, so with that arrangement, you are the one that will choose your roster. So for me, I was asked by the employer, how many days do you want to work? So it's up. That's how different we are here, guys. That's my fellow doctors. You are the one controlling your sellability. I would just say, like, if you sell yourself, make sure that you also make, I'm not saying that you make demand straight away when you start, but when you already build your experience here, make sure don't, kasi we have this tendency to say, oh, I'm gonna feel guilty if they will say that I will gonna do this. No, you need to make sure that that suits you, that fit with what you need. Don't always think that what they will be thinking about you. So with
Ang lesson dyan is, in Australia, hindi uso ang hiya-hiya dito. You will have to ask, and you need to know your value and your worth and your, you have to gain first their respect. Obviously, you have to prove yung masipag ka and you can do it. You can prove to
Yeah.
them that you
Yeah.
are worthy of this job. So for you, you can easily, let's say, demand, not really demand, but request to be rostered here and there. That's what I did as well. For me to learn more about the different specialty in radiologists, I have to ask my consultant to roster me here, there, and everywhere. Otherwise, they will just roster me in something that I already know. And I want to grow in my skills. And so I asked them to roster me to the areas that are my weaknesses or something I want to
Yeah.
concentrate and study or something. So actually, here in Australia, ask. If you don't ask, you will not receive it. You will not get
Yeah.
it.
Correct.
So
Yeah.
before we continue your journey, if you don't mind, there's just two questions that is in the chat. First question was, what are the problem in gap of practice? Bakit mo, how do you answer that question? Why is it
Very
important
good
that you have
question, that one.
recency of practice? Because there are other Filipinos who are not moonlighting or doing other things, doing research, doing non-clinical work.
Yeah.
Yeah.
I can definitely answer that, Doc Van, because as you all know, I've been working already being a nurse for 5 to 6 years before going back into the medical field. So even though I passed my AMC MCQ way back in 2016, I am not sellable. They are not hiring me because I don't have a recency of practice. I don't have a recent CA practice, or else I have to go back in the Philippines. I don't want to go back in the Philippines anymore after getting the permanent residency. It's the same thing because there's no assurance for me that I will be able to pass my clinical. So I said, look, why would I do that? Now, what happened is, in APRA, when you apply, because as what I told you, I've done everything myself, DIY, from visa to APRA application to completing all the paperwork. What I did with my employer is I did my own documents and everything, and the director just signed it. Even though they are supposed to be the one doing it for me, I do it such that I can be sellable to APRA as well. So he signed because they have trust in me. That's the reason why. That's how you sell yourself to them. That once you gain their trust, they will just sign it for you. So that's how I did. So there is a document in APRA where you will be asked for a document of the supervision plan. So when we submitted, so when you go through, if there's some people here that is on the same boat. I'm very much happy to go through with you with how to complete the supervision plan, because I did it myself. I did everything myself. So when you do a supervision plan, that is a requirement for limited registration for international medical graduate. The supervisor will need to put in there according to the level that they will give you: level 1, level 2, level 3. So that's the levels that you need. Level 1, guys, is 100% every single patient that you examine and you see should always be discussed by your supervisor. And that's the requirement by the APRA and the medical board. Level 2 supervision is 80% of the patient that you see should always be discussed by your supervisor or your senior consultant. Level 3 is when you now a little bit of a seniority in the resident medical officer pathway, that a registrar can be a level 3, meaning to say 100% of your patient that you see, you don't need to discuss with your consultant. However, for safety of your registration, I still always discuss it with my consultant if I'm a bit worried that this is something that a bit not easy. Now, there is also another form that you need to complete in order that you can there is what we call return to workforce. There is a document that the APRA there is a template in there. That is one thing that you need to put in there, that after 6 weeks, the registrant will be able to attend this one. After 6 weeks, he will need to see about 6 pediatric cases. After 3 months, he need to do this and this. So it's basically doing a bit of a goal. So if you're working as a GP or probably working as a thing, we call it a management plan, that we always go through the patient. What's our goal for your condition? So that's one thing. So I submitted that with a bulk of documents to APRA, send it, paid the $1,700 or $1,700 registration fee to APRA. And then they will assess your paperwork and credentials and say, look, and then they are the one to give what sort of level are you appropriate. But because I don't have a residency of practice, me and my supervisor agreed that we will start with level 1, because 1, it's for my own sake, that I am being safe with my practice and I am safely providing a safe care to the patient. Because guys, here, legalities and all the indemnity and everything, you will be sued easily here. You will be sued easily. Patient will complain straight away. We have what we call health ombudsman. Diyan sa Pinas, kahit na ombudsman na yung mga politiko, hindi pa rin na convict. In here, the health ombudsman is very, very serious. If you committed something, and then the patient can easily directly contact the health ombudsman. That's why I said I'm very happy to start with level 1 supervision, that every single patient I see, because it's been a while that I haven't worked as a doctor, my supervisor will always be there, can be contacted easily if I see a patient. But because he knew me already of how I work as a nurse, he knew me sort of thing. So even though he's not physically around, I can easily text him and tell him, this is the case. What do you want me to do? Are you happy with my plan? Those sort of things. So that's, you always have to document it in your plan, discuss with Dr. Apolinario Mabini or Emilio Aguinaldo, whatsoever in there. So that if something came back, then you will not be the one targeted. It's your consultant, because you discuss it with your consultant. Yeah.
So I have a question. For you, it's easy to get into the ACRRM pathway. Paano naman yung iba na nasa Pilipinas pa? paano sila makaka-apply to do the ACRRM? Do they need to be
Don't,
here? Do they need to
no.
be here and work as an get an RMO job first?
Yes. So don't, the one I'm telling you at the moment is when you're already in a senior level. The ACRRM all has the college, either ACRRM or the RECGP or the rest of the college have their own eligibility criteria. I went through 3 different stages. You need to, so at this stage, don't think about joining the college at this stage. No, start from the bottom. If you're a specialist back home, as what Dr. Vanessa has said and told you, if you have been working as 15 years on 10 years or something, probably try, but they will probably give you a little bit of years of experience and accredited something like that. But if you're a new graduate, I'm talking about the new graduate or probably been new in the medical field, dyan sa Pinas, I would rather encourage to start on a standard pathway. When you finish your AMC 1, that is your ticket to apply for a job. Don't think about applying to any college. Your aim is to apply in a hospital. The reason why for that is when you successfully pass your AMC 2, at least you already complied with the, you remember I told you about 10 weeks in surgery, 10 weeks in medicine, and 8 weeks in emergency. You cannot do that if you're gonna do that in the GP. But the GP has another pathway. The hospital, so aim to do the hospital first. A lot of hospitals now are recruiting AMC 1 passer. A lot of hospitals now from Southern Australia, Victoria Health, New South Wales Health, Queensland Health, or even where Dr. Vanessa is in Perth, WA something. They have a lot of different health. Ramsay Health, other type of health organizations are willing now to hire level 1 or minimum is level 2, but I think they are now opening to level 1. So level 1, level 2 limited registration is you can work in a hospital and do a rotational shift as an RMO. So RMO is junior house officer or senior house officer. So that's what an RMO means. So I encourage everyone to pass or to do the AMC 1. And for those people who are already a specialist on their own field, always weigh the benefits, whether, because I know when you're a surgeon back home, you can earn a lot of millions already. So if you're an orthopedic surgeon or a whatever spine surgeon and everything, I think life there is, I think you'll be earning more the same as well in here.
It's comfortable. They have comfy
Yeah.
life already.
Yeah, comfort life already in there. However, if you are still new in the medical field and not on a training, and if you want to come to Australia, do it as soon as possible. I'm not discouraging everyone, but this is just of what I have noticed with those people that I knew who are already a specialist in the Philippines. They already have a hard time preparing themselves for the exam because it's the general medicine. So if you're an obstetrician there, you will have a hard time understanding the medicine. You will have a hard time understanding the pediatric and those sort of things. But it's not impossible as what I'm always saying. So don't lose hope. It might take a while or it might take a month to prepare, and it's individualized. Some people would take 1 year to prepare for the clinicals or for the AMC 1. Some people would take 6 months. Some other people, for me, I'm not boasting, but I prepare myself for clinical for 2 months while working full-time job as
You
a nurse.
already have the clinical experience as a nurse. You already know what doctors do to manage
Exactly.
different
Yeah.
diseases, and you are very familiar with the Australian health system. So your 2 months is fine. Actually, I've spoken to some doctors, Pinoy doctors in Adelaide, who passed their AMC 1, applied for RMO jobs, And then while they're waiting for their RMO job offers, they studied for AMC2 for 2 months, and they just passed our Philippine Medical Board exam. So because everything is so fresh and they're still, motivated to study, I think and
Yeah.
then that's your only focus. It's easier for
Yeah.
them to pass that exam,
Correct.
and they got a job in Adelaide. So there's a handful of them that I spoke to already
Mm.
last year.
It's really individualized. So that's why I'm encouraging those that are still new in the field of the medical field, that as if you really want, if you're wanting to come to Australia, do it as soon as possible. Because as that's why I've met some young ones when I was preparing for the clinical too as well, because I start for the that extensive intensive 1 week preparation for the clinical in Melbourne. And there's one there who is already a passer of an internal, I think he's a diplomate already in internal medicine, but I don't know what happened to her. Probably she passed as well, but she did stay in Australia for 3 months to prepare for the exam and enroll the clinical course review, and paid almost 10 grand for the exam, for the preparation alone. $10,000.
Wow.
So it's really up to what you want to do. So, but at this point of time, it's a lot easier for you guys now to come and apply jobs in Australia with AMC1.
Nag-review
Yeah.
school ka ba ng AMC2 or you studied on your own?
I studied on my own. Kasi I'm type of a person, Doc, na I cannot, my brain is not working if there's a lot of people studying, because of, a lot of marites and of, eating and sort of things. So, so I studied on my own, because I don't have time, because I'm working. So cath lab is a day procedure unit. So I've worked in the morning, go home, sometimes 6 o'clock at night, or sometimes on call for a STEMI. For if there's a STEMI, we need to do a PCI and put a stent in and everything. So sometimes on call. So I just studied during the night, probably up till 1 to 2 o'clock in the morning, something like that. What I did is just go through all the previous
Exams or questions.
scenarios, the what they call recalls.
Yep, yep.
I did all the recalls and then put myself in. So I've always, para akong, I feel like I'm a mental health patient, because I'm talking to myself on the computer just by myself. And another thing I did was I always, because I'm not being a nurse, you lost your examination skills. I forgot how to examine this and how to examine that. So what I did is, the Weber test and whatever. What's the other one? Rhine's test or something. I forgot about it. So I always go to Google, YouTube. There is
Ang
a
dami
very
dun
good,
eh.
yeah,
Marami dun.
very good demonstration of how to examine the hearing test, and what is a Weber, what is a Rhine's test, and what's is it sensory neural defect, blah blah blah, and the ortolani and all those one of them, because that's part of the exam in the pediatric. Ortolani, Barlow's, whatever, tuwad mo yung bata, ganito ganyan. So yun, tapos yung mga orthopedic examination, emptying can test, what sort of muscles that being tested, sort of thing, doing this abduction and everything. So those, I've learned those ones by looking into the YouTube, because I'm a visual type of person. I cannot understand if I'm be reading, because I'm that
So
not that smart reading.
I think we need to do another session, and I know you're very tired, and it's already 11 o'clock p.m. there,
Yeah.
and you're from duty. So I think we need to do more sessions, and we'll go through the questions and try to answer and invite them again. Or if you're okay, can we invite you again maybe next month or something, when you're not off duty and you're fresh? But everything you said, it's very inspiring. Your journey is very inspiring. I'm really grateful. We're all really grateful for sharing your time in the
Yeah,
wee
probably, yeah.
hours of Queensland time. But for now, to wrap up, can you give us what are your three blessings now? No regrets, obviously. What are your three blessings? What do you appreciate and grateful now that you're in your year 2 of GP ACRRM training?
Um, I think the one is I am, after all I've been through, sort of thing. So I'm now a bit proud of where I am now at the moment that, look, I was like, oh, I've I surpassed and survived that one. Like before, I don't know, this is just a little bit of dramatic, but I drive, I'm driving a car now, a good car, and then I'm passing through the road that I usually bike,
Oh, ang
right, sort
sarap
of
naman
thing.
ng
I just like
feeling.
sometimes I was just like think about myself, how did I able to survive those years?
Pinch me moment, no?
Yeah, so I was just like, when I was driving with this good car, blah, 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 and sort of thing, I was just imagining myself passing through my car now. It's like, oh my God, I'm so pulubi. I'm so like nakakaawa. I'm nakakaawa, but during that time, I didn't think myself as nakakaawa. So
I
that's
don't think
what,
nakakaawa ka nun because you are earning dollars already working
yeah,
as an aged care
yeah,
nurse or
yeah.
you're still earning a lot above minimum wage anyway.
Mm. So that's one blessing. Is another blessing is with my thing is I can my so at the moment, doc, is even though I'm working as a GP, I'm also doing an emergency reg. So the reason why I'm still get from late tonight because I work as a GP from 9 o'clock to 5 o'clock today, but my previous job wants me to come to work at tonight from 5 to 10. So that shows that when you really work and showed your skills, they would really appreciate you, and you are not the one looking for them. They are the ones who look for you.
Yeah. Yeah, that's
Yeah.
very good. That's beautiful.
So always put a value on yourself. Show to them what your capabilities are, what your potentials are. And then when they notice that, wait, this is very skilled person. This has a potential. This is the capabilities sort of thing. Show to them who you are, what you have, and then be passionate of what you do, because that's what I always do. I always been passionate and everything. So even like the oldest here, there's a greater percentage of older population. And when you get to talk to them, and when you get to manage them, and you get to treat them, and you're able to send them home, they will always tell how lovely you are. Can I take you home? Those sort of thing. And that's
Ah,
one thing.
beautiful.
That's one thing. You always treat them as if you're treating your own family member. That's
Yeah.
one thing that I have to 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 remember.
Well,
And then
you're beautiful. Congratulations. Congratulations on your double registration. Congratulations for being registered nurse, clinical nurse, and nurse tutor. Now, trainee, ACRRM, GP, rural remote doctor. You're amazing. Congratulations for all you've
thank you.
achieved.
Yeah,
You're
yeah.
an inspiration. And thank you so much.
Yeah.
All the best. God bless. Good luck with your next 2 years of training. And we
Yeah.
wish to see you again and share more about your journey. We
Sure.
will be
Just
cut
contact
off
me, Dr.
in
Gan. Yeah.
yeah,
Mm.
we will be cut off in less than 1 minute. Thank you everyone for
Thank you,
joining us.
everyone.
Thank
Good
you,
luck. Good
Paulo.
luck with your journey. Yeah.
All the best. And don't forget, don't hesitate to DM us and we're happy to help everyone.
DM us, guys, if you ask for L.
Yes, we're here to support you and guide you. Thank you. Good night. Bye.